Hello and welcome to Cahuilla Health's biweekly community engagement webinar. Today is Thursday, August 19th. My name is Deborah Volison and I'm the Director of Community Engagement for Cahuilla Health. I want to thank everyone for joining us today and just remind you that the purpose of this webinar is just to give you the facts about Cahuilla Health. We said it several times last year, but I'm going to say it again. We are not a political organization and we do our best to try to just stay with the facts and stay out of the fray. And so we appreciate you being on here and helping us to spread the word of what is happening at Cahuilla Health. I'm joined today by Gary Herbst, our CEO, and we're going to cover a lot of questions today, Gary, because a lot of stuff has happened.
Yep.
Since we were on two weeks ago.
Never a dull moment, that's for
You know,
certain.
you sometimes think, oh, well, this is the same question that was asked a couple of weeks ago, but today we have different answers.
Yeah, exactly. Yeah, it's that's the one constant throughout this pandemic is the variety that certainly it has presented. So
Right. Okay, well, let's start like we always start
all right,
with the
thank you.
numbers.
So we've stopped, reporting on what's going on at the statewide level, and the numbers have just gotten so large into the millions and millions that I don't know if it really provides any perspective and value anymore. So definitely continuing to focus on the local condition here. So yesterday, the county had reported that since the beginning of the pandemic, we now stand at 52,342 positive COVID cases throughout the entire county. Just yesterday alone, 853 new cases just in a single day. There have been 855 COVID-related deaths since the beginning of the pandemic, and that number is inching up, but it's usually like, one every couple days. We had a couple over the weekend, definitely we're seeing the mortality rate of COVID declining, but we do worry. It's kind of the lagging indicator. It's the last one, and so we'll talk in a moment here about all the growing volume of COVID inpatients that we're taking care of. A number of them in the ICU and on ventilators, very sick people, and it's quite possible that some of them could pass as well. So a newly reported number by the county, they'd actually, once we moved out of the Blueprint for a Safer Economy program and we were looking at that color and tier rating, once that was removed by the governor back in mid-June, the county stopped reporting the daily case rate and the positivity rate, but now they have reinstituted this on their daily email. So they reported that the 7-day rolling average of average new daily cases per 100,000 population is currently running at 21.2. You remember, or maybe you remember, that we had to fall below 7 to finally move into the orange and the yellow tiers. So at 21.1, we were well above, probably twice as the number to be in the purple tier. So, and the 7-day positivity rate in terms of the percentage of tests that are taken, what percentage are actually testing positive, the county stands at 8.7%, and we currently have a little over 1,600 active COVID cases that the county health department is managing right now. In terms of what's going on at Cahuilla Health, the Downtown Medical Center, I didn't yet have this morning's report, but on Tuesday we had 99 positive COVID adult cases. Yesterday that number fell just by 1 to 98. So hoping that it's at or below that number, although falling from 99 to 98 was actually the first day in probably 2 weeks that the number actually plateaued or declined. Since then, it's been rising pretty consistently, 5 to 10 new inpatients every single day. So that was good to see. that it actually stayed about the same. So 98 COVID positive patients. Most all of them are in medical surgical beds. So we only have 16 of those 98 that are on an ICU, and 14 of them are intubated and on ventilators. So I wouldn't say we're seeing a milder case of hospitalization, but you may recall during the height of the pandemic in December and January, I was reporting that we were pretty consistently 25 to 30% of all COVID cases were in the critical care units. So definitely a lower percentage, below 20% in ICU. We currently have 77 COVID positive employees that are out on a COVID leave of absence. 44 of those employees were fully vaccinated back in December and January. So those are called breakthrough cases. So these are employees that had been fully vaccinated, these 44 that have now contracted the virus. They're exhibiting pretty mild symptoms, but there is the taste and smell loss. There is general, weakness, being very tired, definitely, respiratory, congestion and cough and things of that nature. But we only have one employee that is currently hospitalized with COVID. We also have an additional 22 employees that we suspect may have COVID. They've been tested. We're waiting for those test results to come back, running them on the molecular PCR platform to get that higher sensitivity and specificity. And then we also have 14 employees that are having to quarantine at home. I'm sorry, I got that reversed. The 22 employees, they actually are on a leave of absence because they are unvaccinated. 22 unvaccinated employees that are being quarantined at home because they live with somebody that is COVID positive. So 77 with COVID themselves on a leave of absence, 22 that are unvaccinated. They're not COVID positive, but they live with somebody that is COVID positive, so they have to quarantine. And then we have an additional 14 that are suspected of having COVID, and we're waiting on test results. I'm delighted to report that our employee vaccination rate has climbed to 65%. So just about a week ago, we were at 55, clicked up slightly to 57, but I just got a report today that it has risen to 65%. And I want to commend our medical staff. So our physicians, our physician assistants, our nurse practitioners have now hit 92% vaccination. So, these are experts in the field. They are scientists. They are steeped deeply in knowledge and experience of medicine and vaccines and viruses and things of that nature. So to see a 92% vaccination rate among physicians should be, very compelling to us, and hopefully our unvaccinated population is looking at that and has trust and confidence in our physicians, and hopefully follows in their footsteps. We continue to be an incredibly busy hospital. So at a little after 7 a.m. this morning, our adult inpatient occupancy rate at the acute medical center stood at 91%. 7 of our 41 ICU beds were open, 9 of our 54 ICCU beds were open, and 15 of our 249 medical surgical beds were open. So that's a slight improvement from where we were just a couple days ago when we were at 95%. In fact, it might have been just yesterday that we were at 95%. So I know we'll talk in a bit about the major surge we felt on Monday and calling the code triage, the internal disaster. But definitely things have settled down from what we were experiencing Monday of this past week. So that's where we are.
Okay, can I add something about the numbers? We
Yeah.
had a couple of messages. People reached out and said, what about children? Do you have children in your hospital? So I reached out to our pediatric team, and we do not, or as of Wednesday morning, we had no children.
As of this morning, we have no, no, you're right. I haven't seen today's report. So as of yesterday, when I report 98 COVID positive patients, all of them were adults. We don't have any COVID positive pediatric patients. We did have one about a week ago, but that patient was discharged.
Right, right. Okay, fabulous. Thank you, Gary. Okay, so we called a code triage this week, and can you just briefly explain what does that mean? I sent it out to all of our community engagement participants, and
Deborah, you know I can't explain anything briefly. I mean, I got to give. So across the nation, there is a system called the Hospital Emergency Incident Command System, or HICS. So we employ that same emergency system, as does every hospital in California. And we call code triage, which is kind of, code alert, or a external disaster or an internal disaster. So hospitals like us, I wouldn't say frequently, but certainly occasionally throughout the year, we will call a disaster. Most always they're external disasters, where there's been a major multi-car accident on Highway 99, or a group of farm workers has been exposed to a pesticide spraying, and so in those cases we'll call an external disaster and stand up our incident command system to deal with that specific event. But on Monday, we reached a crisis situation internally. We had 161 patients that were in our emergency department. So that didn't include visitors. That was because we don't really have any visitors in the ED right now, but literally 161 patients. And if every single bed was open and staffed in the emergency department, including the new Zone 5, the 24-bed unit was just opened, made its grand opening yesterday. If every single bed was open, that's 73 beds. And we had 161 patients in the ED. So we called an internal disaster, which then prompts the opening of the command center. So we turned the Asequia Wing conference room into that command center. And then literally all of our directors know when they hear that overhead page or get alerted to the code triage, they report to that command center. And then we give a briefing on what's going on. We immediately begin, everybody kind of drops everything that they're doing. This becomes the singular focus. And so we then, on the whiteboards, what are we going to do? Bringing in, calling in nurses, creating a labor pool of non-clinical people. So the people in finance and HR and marketing, they know to submit their labor availability form. So we actually had employees here in this building that volunteered to drive patients home that were ready for discharge but didn't have a ride. Stripping beds, going up in the patient rooms and pulling linens and getting them ready. So it's really kind of an all hands on deck. And so we brought in, physicians came in to help start discharging patients up on the nursing unit, so that we could then move patients from the ED up into those areas. So that's in essence what a code triage is. Because of the incredible work of our leaders, our staff, our physicians, we were able to really overnight, Monday night, get things going and really calm things down. Last night, going into the evening, we only had 13 patients that were holding in the emergency department waiting for a bed to open up. And at the same time, we had 27 patients that were ready to be discharged and go home. So by the time nightfall came, we'd pretty much been able to clear out the ED and breathe a big sigh of relief, and so it's kind of somewhat normalized. And we've now, we call off then the code triage. We end it and formally announce that the internal disaster has been ended.
So we had community members reaching out saying, how can we help? How can we help? But it's kind of...
Yeah, no, I certainly in this particular disaster, if you could stay away from the emergency department, you know, our urgent care centers, we declared the disaster at 1:30 in the afternoon on Monday. So it was at 1:30 that we had 161 patients in the emergency department. Only 63 of them needed to be admitted. So that was 100 patients in the ED that, you know, they may have been there for a true emergency. Certainly those that needed to be admitted were. But we continue, you know, every day we get lots of patients that are there for non-emergent reasons. So certainly if the community can, you know, kind of assess how, you know, serious they think their injury is, maybe contact one of our urgent care centers or one of our clinics to, you know, talk to a nurse, talk to a doctor to see where should I really be going. So if you could have gone to the urgent care center instead of the ED, that certainly would have been a benefit to us that day.
Okay, so the COVID numbers back in, our highest number was what, 170?
Yeah, I thought it was 170. I'm hearing 169.
Okay, so they were high back in January and December.
December and January, yeah, 20 and 21.
And we didn't call a code triage at that time. So what's the difference?
Well, for one thing, we were still under a code triage. So the first code triage internal disaster was actually called back in March of 2020 when the pandemic broke. So that's when we first turned our Asequia Wing conference room into the COVID command center. And that command center and that internal disaster actually stayed in place all the way until April of 2021. So technically, in December of 20 and January of 21, we were still under that original internal disaster. Okay. We were under a code triage. Now, that said, I mean, it was a very difficult time for us, no doubt about it. We had hundreds of employees that were out on COVID leaves, but we had never experienced 161 patients in the emergency department. So that was, for me, that was kind of a first-time experience. And I've talked to a number of folks, they don't remember us ever having that high of a demand on the emergency department. So, so this one was unique in that standpoint. We definitely were continuing to feel the nursing shortage across the entire organization. I just confirmed with Diane Cox, our Vice President of HR, that we have a little more than 500 open positions. So these are, you know, they're posted, we're recruiting for them, but they're currently vacant, and about 130 of them are bedside nurses. And soon, with the arrival of several more contracted travel nurses, we'll now have 100 traveler nurses that have come from all over the country to work here at Quia Health for, still working on that.
I know.
But we love our travelers. They are an incredible boost to our workforce. They slip right in. They come with experience and training, so they're quickly onboarded. Yeah, to be at 100 travelers, that's a high level for us.
So back to the code triage, when you say all hands on deck, it's like all employees submit their names to the labor pool and you're assigned wherever they need you.
Yes.
And so I was assigned to the ED, and you know, we get a lot of flack for, you know, our ED. We get a lot of complaints, but that is a different world.
It is.
I'm
Did
non-clinical.
your heart start beating a
I
little
was
fast?
like, it was very hard
Yeah.
for me. There were so many people, and I was just doing whatever I was told. And then when they said, could you go make some beds? I was very happy to go make some beds
Right.
just because it's such a,
And you feel comfortable doing that?
yes. Because,
Yeah.
in the ED, I'm passing out stuff, and you just
Right.
can't give certain things to certain people
Right.
who might have
Yes.
different diagnoses. So
Yes.
it was very crazy.
Yeah, I mean, I'm down in the ED fairly frequently, and it's a unique group of people. I really admire them. Doctors and nurses and techs that thrive in that emergency department. Just the intensity, the variety, the excitement, the adrenaline. It's hard to work in the ED, and oftentimes employees will work there for just a few years. But then there's some lifers. I saw Dr. Jerry Jacobson and I were getting coffee together a couple days ago, and Dr. Jacobson, he's worked for decades in the Kauai Health Emergency Department, and such a great guy. But I really tip my hat to
Yeah.
those folks.
Absolutely. So you mentioned our short staffing. Did that have anything to do with the code triage, or was that just another layer?
Yeah, I mean, that certainly compounded the situation, and it caused us to have to go out of staffing ratios. But for us, it was more of a physical capacity issue, and not as much as a labor issue. But definitely that impacted us. We had to stretch. We were calling nurses at home that maybe had finished working their third shift and were not scheduled to work on Monday. So begging, cajoling, pleading for them to come in. We did that night, or I think it was Saturday night, we increased our extra shift incentive bonus to nurses from $400 to $600 per extra shift. So a nurse who normally works 3 12-hour shifts a week, if they would come in and work that fourth 12-hour shift, we would pay them time and a half of their regular salary plus a $600 bonus. And it's worth every penny of it, but at some point our staff just are too exhausted, and no amount of money is going to motivate them to come in. They just need that break, and we understand that.
Yeah, I had sent a text message to some nurses that I'm close to. Hey, you guys, can anyone pick up an extra shift? And it was like, already doing it on the shift now. So they're worn out.
Yeah,
They're
they
worn
are.
out. Yeah. Okay, so since our last meeting, in fact, our last meeting, we had said Kauai Health is not going to mandate the vaccine for our employees. And right after that, probably a couple of hours after that, we got word that something was coming around
Right.
from the state. And the
Right.
very next day, the state issued
It's a mandatory
it's
order.
mandatory.
Yeah.
So how did you feel about that when we got that mandate from the state?
Incredibly nervous. I think I did a very quick impromptu television interview with ABC 30, and the first thing I said is I'm gravely concerned that there are going to be a lot of nurses, a lot of employees that will choose not to get vaccinated for various reasons, and that they couldn't go really anywhere else in California because it was being mandated statewide. There would be those that would leave the profession. They would go into some other work area where they could put their skills to work. Although the healthcare mandate is also applying to doctors' offices and clinics, and so a lot of nurses could leave the hospital setting and go to work in a clinic or a doctor's office, but that wasn't available to them in California. But California is the only state in the nation that has implemented this vaccine mandate. So nurses can go really anywhere. There's a national shortage, so just over the border into other states. So I was very fearful of that. But, and I don't know if we'll talk about that just yet, but there are exemptions that are available to employees that for medical reasons or sincere religious beliefs do not want to get vaccinated. So at least while it's mandated statewide, there is a provision for an exemption that has alleviated some of my anxiety about nurses leaving here. So I'm not aware of any nurses that have indicated their intention to leave or resign because of the mandate. And I'm glad to see, our vaccination rate has climbed up to 65%, and I understand that more vaccination cards will be coming in.
So how do you, and this is a question that even community has, how do you answer the argument or defend the argument that says, well, if vaccinated employees are getting it and vaccinated people are getting it, why should we get it?
Well, again, the vaccines, the 3 vaccines, Pfizer, Moderna, Johnson & Johnson, were never designed or created to prevent somebody from becoming infected. They were designed to keep somebody from becoming severely ill, hospitalized, or dying. And they've been very, very effective at that. But they've also, early on, they've been very effective at keeping people from even getting infected, and then therefore keeping them from transmitting the virus to other people. But the vaccine does appear to start waning over time, and so that's why we are seeing more fully vaccinated people contract the virus, particularly this Delta virus, which we've said often appears to be much more contagious. The viral load is generally between the original virus and the Delta virus is about 1,000 times greater. The Delta variant also appears to be very elusive in avoiding our antibodies, so it's able to hide in our bodies while it multiplies and catches our antibodies by surprise. So it clearly is not preventing infection, but it still is very effective at keeping people from being severely ill, hospitalized, and dying. And I'll answer that question shortly when you ask me about, so tell me about the hospitalized patients, unvaccinated, vaccinated. So I still encourage people to get vaccinated because the fresher if you haven't got vaccinated yet, you will have a very high titer of antibodies. For somebody like us that got vaccinated back in December and January, we're now at that 8-month mark since our second shot, and that's where we're really seeing. That's why we're seeing 44 of our 77 employees were fully vaccinated, but that was back in January. And so now they're contracting the virus, but they're home quarantining, they're not in the hospital, and their symptoms are more mild, but they also then can transmit to an unvaccinated person that could become severely ill, hospitalized, and potentially die. So getting vaccinated is still the right thing to do for protecting yourself from severe illness, but also passing it on to an unvaccinated person.
When is that third booster going to be available, or the third shot, whatever you want to call it?
Oh, Dr. Manga last night, our chief of staff, I was talking about at the medical executive committee meeting. She was calling it a booster, and I corrected her and told her, no, it's actually a third shot, Dr. Manga. And I don't know why I did that, because obviously I'm a pretend doctor, if anything. And I apologized to her later. I said, sorry for trying to impersonate a physician. But what she was saying is that, yes, the third shot is identical to the first and second shot. It's the same amount of vaccine. If you got Pfizer, your first and second, your third should be Pfizer. If you got Moderna, first and second. Your third shot should be Moderna. Johnson & Johnson is not quite ready to give a second dose of it. It's a single dose shot. But when you receive that third dose, 8 months after you had your vaccine regimen, that's called a booster shot. So I guess maybe we were both right in that it is a third shot, but it is in fact characterized as a booster shot. So the FDA and the CDC actually approved it, authorized its that third dose administration to immunocompromised patients. So fully vaccinated patients, but they had maybe an organ transplant, late stage cancer, could be on high dose steroids like prednisone. So various stated categories of compromised immune systems, they are authorized and eligible now to receive that third dose. But I just read today, and we heard news on Monday that, I think Monday or actually I think it was on Wednesday, our director of pharmacy got word that the FDA is about ready to announce, and they may have yesterday, but they'll send out a formal publication probably today or tomorrow, that now anybody, immunocompromised or not, that is 8 months removed from their second dose is now eligible to receive that booster shot, that third dose. So all of us that got vaccinated back in January are now 8 months, and you go to that specific date that you receive that second dose, and you count 8 months past that, and if it's today or earlier, then you're eligible to get that third vaccine. Now, what I read in the paper this morning, and I guess that's where it was announced that the FDA is about ready to issue this, that it wasn't until like September 10th or 15th that this third dose was going to become available to people that are 8 months out. So I don't know why it's September and not now, because immunocompromised are now. It could be availability of vaccine and waiting for it to be distributed, but we will be an administrator of that, so we will, through our Cahuilla Health Network of clinics, we will be making that third dose available to our employees and other community members.
Okay. So I want to jump back to the employees for just a minute. So if an employee refuses to take the vaccine, and we have a testing mandate in place as well. So what happens, so starting on Monday, we have to test all unvaccinated employees.
Those that work in patient care areas.
Okay.
Yeah, so now I'll get into this whole thing. So, so the first mandate, or the first executive order that came out from Governor Newsom that Deborah was talking about was requiring all healthcare workers to provide proof of vaccination to their employer or be subject to regular COVID testing if you were unvaccinated. And if you work in a building in which patient care is provided or in which patients enter, and you're unvaccinated, then you must submit to twice a week COVID testing. But then a week later, the governor issued, and that executive order does go into effect Monday on August 23rd. Another order at the same time that was issued was relative to visitors. So visitors must now, when they enter the hospital, provide proof of vaccination or proof that they've tested negative for COVID within the last 72 hours. That went into effect on August 11th. So we've been having to comply with that since that date. But on Monday, we'll start doing about 2,000 tests a week. for the unvaccinated population. But this subsequent executive order that made vaccination mandatory, so that no longer makes that, get vaccinated or show proof of vaccination or get tested twice weekly. That's not an option anymore. Now it's you must be vaccinated if you work, again, in an area where patient care is provided or patients access. So you can only remain unvaccinated if you submit a formal declination form stating that you have a medical reason why you cannot be vaccinated, and that medical reason has to be supported by a signed physician note or document. Or I don't know if they signed the declination form itself, but it has to be attested by a physician. Now, we don't have to know anything about their medical condition. We will ask nothing about it. All they have to state is that for medical reasons, I'm not going to get vaccinated, and a physician has to sign it. Interestingly, the California Medical Board earlier this week sent notices out to all California physicians warning them not to provide medical exemptions unless it could be clearly demonstrated and documented, and that if physicians did not abide by that they were subject to fines and other penalties and potentially risk of license. The other exemption is if an employee says, I have a sincere religious belief that prevents me or causes me not to get vaccinated. And again, we will not ask any questions. They don't have to provide any proof of their religious belief. They don't have to show that, their religion. There's a document that shows that we don't believe in this COVID vaccine. There will be no questions asked and no evidence has to be provided. But they do have to sign and submit that declination form. As of a couple days ago, we have 96 employees that have submitted those signed declinations. 92 of them are for sincere religious beliefs and 4 of them for medical exemptions. So that was just a couple days ago. Employees have until September 30th to submit those declinations. So that's the only way that you can now not be vaccinated, is through those declinations. So come September 30th, if you choose not to be vaccinated and you don't decline for one of those 2 reasons, then their employment will be terminated. For those that do submit those declinations, they're unvaccinated right now. Monday, August 23rd, they will be unvaccinated. So they will be subject to that twice a week testing of COVID. And then on September 30th, if they have submitted their declination, they will continue their employment with CWEA after September 30th and forward, but they will continue to receive that twice a week testing. And that will be indefinite until the governor finally rescinds that requirement.
And that's a big financial burden for the hospital, the testing.
It is. Just logistically, I mean, it's been a Herculean effort by so many leaders and staff. It's unfortunately, we had no idea that this executive order was coming, and we had little time to prepare for it. It literally actually went into effect on August 9th, and then you have until August 23rd to be in full compliance or be subject to fines or suspension or and at the time we only had a 55% vaccination rate, so we were looking that we're going to be conducting thousands of tests every week, every month, and we cannot charge our employees for that test. So that financial burden is entirely on us. We've ordered, I think, 16,000 of the Abbott, what's the name of it? Binax, Abbott Binax Now, which is a home testing kit. And so we will be distributing to all of our, almost a couple thousand unvaccinated employees. We'll be distributing 2 weeks worth of this Binax Now testing kit. So every Monday morning and Thursday morning before they come into work, an employee will self-swab, not the deep nasopharyngeal, but a swab. They will place it on the card, a little squirt of reagent, and watch for the results to appear in about 15 minutes. Then they will sign in to the Cahuilla Health portal, the electronic portal, and they will register their results. And they have to do that every Monday and Thursday. If their results are positive, then they call in and they will quarantine at home for the 10 to 14 day period. If they're negative, then they will come into work. But they will repeat that every Monday and Thursday, every week. Every Tuesday and Friday, our staff will log into the portal to make certain that all unvaccinated employees have completed their test and to do the follow-up if they haven't. So yeah, it's an incredible burden on us, both from a manpower standpoint, but also a financial standpoint.
Mm-hmm. So you mentioned that we've seen an increase in staff vaccinations, but overall in the county, has there been an increase of vaccination demand since this mandate was sent out?
Everything I read every day, I think we're still hovering at that 37% vaccination rate. So I don't really see any uptick. I mean, obviously, we're seeing an uptick in our employees. A 10% rise is 500 employees that have gotten vaccinated recently. But I don't know if that just hasn't registered yet. We haven't seen a real increase in vaccination demand at our various clinics. We do vaccinations at all of our rural health clinics and our urgent care centers and out at Visalia Medical Clinic. But the volume of new vaccinations is pretty low.
So what vaccines are we offering right now at all of our clinics?
So we offer Moderna and J&J at all of our clinics currently, but we have Pfizer on order, and we'll soon have Pfizer available at those clinics as well. So really soon we will have all three versions available.
And so even employees would go to MyTurn to schedule those, or?
Yes.
Yes, okay.
Yes.
All right. So you mentioned this a few questions ago. What about our COVID positive patients? How many of those are vaccinated versus unvaccinated?
Okay. So starting on July 1, we started asking patients, COVID positive patients, at the time they were being admitted, whether they'd been vaccinated or not, and if so, when. And if they hadn't been vaccinated, had they ever had the virus, and if so, when? So as of right now, all indications, and it makes it a little difficult because not all patients are willing to reveal their vaccination status, which is their right, to share it with us or not. Or patients are confused. I mean, they're coming in, they're COVID positive, some critically ill, and so it's difficult to get, accurate information from them. But for those that we can, we are currently running about 87% of our COVID positive inpatients are unvaccinated. So that leaves 13% that are vaccinated. But so there's a couple possibilities. One, and we've seen this, is that they are vaccinated and they have COVID, but that's not why they're in the hospital. They're in the hospital for something completely different. And we actually had a patient that unfortunately passed away in the ICU that was COVID positive and fully vaccinated, but that's not why they were admitted and that's not why they died. So some of the 13%, again, fully vaccinated, and we tested them on admission, and they were COVID positive, but that's not why they're in the hospital. They could have been in a car accident, they could have had a heart attack, they could have had a stroke, they might be having a gallbladder removed, a hip fracture. So there's some of that 13%. It's just while they have COVID, that's not why they're in the hospital. But I would imagine there's some breakthrough cases that actually they get to the point where they think they need to be hospitalized. They're fully vaccinated, they contracted COVID. You know, what might start out to be mild gets a little progressive. Maybe they've got some underlying conditions that exacerbate it. Certainly all the smoke in the air is contributing to more respiratory distress. Maybe in an older population, we're seeing them come in, but they're generally just staying a few days in medical surgical. So right now in the ICU, we have 16 patients, COVID positive patients that are in the ICU. 15 of them are unvaccinated. And the one that is vaccinated is one of those patients that's in the ICU for a completely unrelated condition. They're not in the ICU because of COVID. That's not why they're in the hospital, but they are COVID positive and they have been vaccinated. So again, that's been, you know, my message is that even though the vaccine might be waning in some of us, it is still proving to be very, very effective in keeping patients out of the hospital and keeping them from dying.
Okay, so Chad, wouldn't the 13% in your patient vaccination numbers also include those who did not or could not answer the vaccination question?
Yes. Yes. We then, well, if they didn't answer it, we would most likely consider them to be unvaccinated at that point.
Okay.
But yeah, that's a good question. We would generally default to unvaccinated if they refuse to answer it, because oftentimes if you're refusing to answer, you're probably unvaccinated, and you're concerned that somehow that we will look poorly upon that, or you know, judge the person, which we would never do. But I think they're more likely to fall in the 87%.
And even if somebody is so sick and they're unable to answer it, most likely their family. Are you allowed to ask family if that patient has been vaccinated?
Sure,
Okay.
but then the family member may not know.
Right.
You know, and it's more cautious to treat them as unvaccinated.
Okay.
You know, assume that they're unvaccinated and that they're COVID positive, and but I don't know if that would necessarily affect the course of treatment and the things that we would do to them or provide to them. I think it'd probably be the same.
Okay. So you mentioned the 800 and something new cases yesterday, 853. So we're getting calls. It's very difficult to get in for COVID testing. Sometimes you have to wait till the next day or the day after that. So are we opening up additional testing sites?
Yeah, we are about to. So we offer COVID testing at both of our urgent care centers on Court Street and Demery. Visalia Medical Clinic, I think, does about 50 tests a day that they limit it to because their lines are going out the building again. So they do it Visalia Medical Clinic, or what's now called Cahuilla Health Medical Group. And then we most recently just started offering them at our Tulare Clinic on Prosperity and Mooney. And I've had a lot of friends that I've referred out there, and they've been able to get in. I think they're even taking walk-ins. So we definitely want you to go on to, well, My Turn's the Vaccination. Yeah, if you go onto our website, we have the Clockwise is the platform that's used there, where you can schedule an appointment. But Tulare, I believe, is taking walk-ins as well. I just learned today, confirmed with Ryan Gates, that we're going to put the C trains back at our other 4 rural health clinics. So Exeter, Lindsay, Woodlake, Dinuba. We had the C trains out there that were dedicated to COVID testing. So we're arranging for those to be put back out there, but most likely it will be mid-September, maybe late September before that's all back in place. So it's still going to be a little tight for a while, but definitely go onto our website and look at where there is availability. I think that the county is still doing some mass testing sites. I'm not positive, but again, go onto the county website as well, and you'll see all the different, sites and providers in the county that provide the COVID testing.
What about drive-through testing? Are we going to bring that back?
Most likely not. Just logistically, it did work out. It was great when it was over here on Floral Street, where we closed the streets off early in the pandemic, and then we moved it out to the Lifestyle Center, but we just logistically just don't have the space to do that now. You can, I live right next to a Rite Aid, and they're doing drive-through COVID testing. But I think you have to make an appointment, so you need to call and make an appointment. But so there are some drive-through testing sites, but it's unlikely that we'll have one.
Okay. Have we considered expanding the hours of our urgent cares?
Yes, because I think they go till, 10 or 11 o'clock at night, but we've got a line of people waiting to get in, because other than the emergency department, there's really nowhere else for them to go. So again, I was talking to Ryan Gates just an hour or so ago. Ryan is the VP over all of our clinics, and he said they definitely right now are considering increasing the hours, expanding the hours for the 2 urgent care sites, but our obstacle right now is staffing. So just like the rest of the organization, just a shortage of staff, a shortage of physicians, to be able to work into those extended hours. But we definitely know that there's a need for it in the community, and hopefully we'll be able to accommodate that in the very near future.
So patients are being asked to wait in their cars, and it's been so hot. So the question is...
It was beautiful today.
I know.
It was actually, for the first time, it was pleasant walking down here from my office. So
yeah. But it's been really hot.
And it's probably going to, we know it's going to get hotter again.
So are we going to, is there anything in the works to maybe put tents out or benches for patients instead of asking them to wait in their cars?
Yeah, so when I got that question, I called Dieter Reichman. Dieter is our Director of Facilities and Maintenance, and he said that at virtually all of our clinics, that we have in fact stood up tents and awnings and benches and things for folks to wait in the shade. But he wasn't positive about the urgent care center on Court Street or Demery. So he was immediately going to check it out, and if they don't have it, he was going to make it happen today.
Awesome.
So thank you for that question. He was under the impression we had it everywhere, but if that's not the case, we're going to make it the case.
All right, so right after our press release went out about our code triage, the Unified School District changed their masking mandate, and now children are required to wear masks both inside and outside at school sites. And so the question was, did Cahuilla Health give VUSD guidance on their masking update?
No, we didn't. I haven't personally, and I don't think anybody in a leadership position at Cahuilla Health has spoken to anybody at the school district about masking policies at all during the pandemic. At least I've never, whether it's indoors or outdoors. I did get a question during that press conference, and we had a lot of people. We had hundreds of people on it, and thank you if any of you were on that as well. But we got a question from somebody that said they were affiliated with the Visalia Unified School District, I think, or at least they said this question comes from somebody related to Visalia Unified School District, and asked about our outdoor masking policy. And I indicated to them that we do encourage our employees to wear masks outdoors, except if you're walking alone, or you're sitting alone, or you're eating outside, you do not have to wear a mask. Also, if you're congregating with people, but you're able to maintain 6 feet of social distancing, you don't have to wear a mask. We have picnic tables out around our Siren Grill for folks to enjoy their lunch or meal breaks, and they're round tables, but they have high plexiglass that separates into 4 so people can sit, and be fully protected from one another. So they don't necessarily hit the 6 feet distancing, but they're protected and they all can remove their masks. So that's our masking policy, and that's what I shared on the website. I did get an email from a community member that I didn't know asking kind of the same question. Had I spoken to anybody at the school district? And I again told her the answer is no, and I explained to her what I just said. So that it's either purely coincidental that the school district came out with their announcement that day, or if they were listening, but I don't think they adopted the same outside masking rules that we have.
Yeah, this is why I said at the very beginning, we don't get involved in the politics around us. We're just here to talk about what Cahuilla Health is doing, and that's exactly what you did in your response.
Right.
To
Yeah, but I would say, from the very beginning, actually, it was Cahuilla Health that initiated it. We formed a 2-county-wide COVID coalition, and we reached out to all the different clinics and the hospitals and the schools and COS and the county, and tried to create this coalition that would share ideas and bounce things off one another so that we could be somewhat unified in our approach. And I've had emails with Brent Calvin and Tamara Ravelin over the course of the pandemic. It's been months since then. But certainly, we've always wanted to work together and again share, research and information and what our approach is. But certainly that wasn't in this case.
Yeah. Okay. So leadership talks frequently about Cahuilla Health being a place where you can come and receive world-class care. So. And the community member sent this in, so yet they often hear about bad experiences that lead them to believe otherwise. How can Cahuilla Health get all of their employees on board with the world-class care message so that all patients are given great care and consideration when they come to all of our facilities?
Right. Well, it's always disappointing to hear when we let somebody down, when they don't have a good experience, and unfortunately, it seems like it's too common of occurrence. The disappointing letters that I've had to read over the last several months, particularly with respect to experiences in the emergency department. And again, our executive team just had its weekly meeting, and we spent a lot of time talking about a particular letter that we received from one of our employees whose grandfather had a very disappointing experience in the emergency department, and it was hard to read. They're always hard to read because that's not who we aspire to be. We know we're not world class. Becoming world class is a journey, and the expectations are rising all the time. And what seems to be our Achilles heel is consistency. Every person, every time. We see almost 300 people a day in the emergency department. And I do get lots of positive feedback about people that had wonderful experiences and received such compassionate care. And it's heartwarming to hear that. But then you hear from the person that didn't have a good experience. And that may be their only experience they ever have with Cahuilla Health, is that one time. And now they're left with this horrible feeling about us. And as the CEO of the organization, it just, it's a gut punch. It just really tears at me. And but it's that, every person, every time. And I don't begin to make excuses for this, because we're trying to figure out, why is that? Why can't we deliver that world-class care every time? And it's multifaceted right now. Certainly our physical, condition in the emergency department, where we've been under construction for the last couple of years. Thank goodness we got Zone 5 finally open, but now Zone 4, Zone 5, Zone 6, that doubled the size of the emergency department, doubled the size of the waiting room. They're no longer stuffed in these little cubby holes in the Mineral King, right where the old Ambrosia Cafe. That's our current waiting room, and it's horrible. But just the volume of patients we're seeing, and being so full as a hospital, which then backs up the whole ED, and people wait for 10, 15, 20 hours in the waiting room, or in the ED, waiting for a bed to open up. But then also that causes them to wait in the waiting room for those long periods of time, because we can't yet bring them back into the exam room. So there's been the physical part of it, but you can overcome some of the physical part through that caring, compassionate, attentiveness, and we've been falling down there as well. And I know that some of it has to do with that. Number one, we're short-staffed, and we're pulling out all the stops. This morning we said, we need to hire more non-clinical staff to support our clinical staff, just to get people out in the waiting room that are providing just the comfort, a blanket, water, food, companionship, helping somebody get to the bathroom. All of that's falling on the nurse right now, which might be one nurse that's caring for all those people in the waiting room. So we've got to find more nurses. We're bringing in traveler LVNs that can be circulating in the waiting room, attending to people's needs, but we want to now backfill that with non-clinical people just to provide that comfort piece of it. So that's going to happen. But we have to find a way to, somebody said, fill up the cup of our staff. Those staff working in the ED have been at this pandemic for a year and a half now. They're spent, emotionally, physically, they're kind of empty. And that's, that how do you get that back? Where that just loving to come to work every day, full of energy and compassion and empathy, and when they themselves are so down. And again, I'm not trying to make excuses, but it's the reality that we're facing, because the things I'm reading, and too often, is not who we've been in the past. Pre-COVID, that year before COVID, we had saw our emergency department patient satisfaction scores soar. The percentage of patients giving us a 9 or a 10 in terms of their experience had reached an all-time high, and I was getting tons of favorable notes and hearing from friends. And but the last 6 months, the last year, it definitely has turned more negative. So we need to get that back. And it's hard to hit that world class every single time, when you're not just in the midst of the pandemic. You're a year and a half into it, and it's definitely taken its toll on our organization. Folks just coming to work, let alone being at the top of their game. It's a challenge for us, and we fully acknowledge it. We're not happy about that. We don't consider ourselves to be world-class right now. Many times we are, but not every time, not enough. So, and that falls on me, that falls on our leadership, to get back to being on the right path of that journey.
All right. Well, Gary, like always, your transparency is a breath of fresh air. And even when it's good, you said you were going to answer it. When it's bad, you said you were going to answer it.
I like answering the good. I like sharing good news, but yeah.
But we're glad that you are at the head of this ship, because you kind of keep us calm and steering in the right direction. So would you like to close us out?
Again, Deborah, thank you. So, sorry if I sound like a broken record, but again, every chance I get, just express my appreciation and gratitude to all of you for continuing to stay engaged with us and serve as advisors to us and ambassadors out there. We really appreciate your feedback, and I love your questions, even the hard-hitting ones. Again, our commitment to be your source of fact and truth, and keep the questions coming. And you don't have to wait till these biweekly huddles. Deborah and I are available all the time. I get emails from a number of you, and just encourage you, if something's on your mind, something you hear in the community, you want to answer a question of somebody, but you want to make certain you got the facts right, please don't hesitate to reach out, and we will do our very best to respond promptly to you. We want you to feel well informed and well prepared. So hope you all enjoy what I hope is going to be a beautiful weekend. And I never thought low 90s, just
Sounds
nice.
good.
It does sound good. So take care, everyone.
All right, thank you.